quiet but vital fight against the coronavirus pandemic. The Shelby County Health Department team of investigators who do contact tracing are on the front lines of this fight. When someone tests positive for COVID-19, their job is to find out who they may have been exposed to hopefully stop the spread. Fox 13 investigative reporter Greg Coy learned how this process works by talking to the lead investigator. Greg, he's not a police officer, but he's one heck of a detective.
In this case, Darryl, the culprit is COVID-19, and everyone else who may have been exposed is a potential victim. The job of the investigator is to call them, talk to them, get them to open up so that he can shut down the spread. It begins with a phone call from a Shelby County infectious disease investigator to someone who tested positive for COVID-19. Their name given to investigators from either a hospital or clinic.
This is pretty traumatic for a lot of people. So it ranges from tears to crying to total cooperation. It just depends.
Tracking down who has interacted with this infected person is the job of lead investigator Lloyd Kimball and his team of infectious disease sleuths. They must interview the more than 2,600 people who tested positive in Shelby County.
What we do as contact tracers and investigators is we're trying to stem the tide. We're trying to slow it down.
The investigator wants to know who the infected person has been in contact with for at least 10 minutes and within 6 feet.
We try to let them know, hey, we're here to help. We try to tell them what it is we want to do and why we do it.
Kimball sketched out to Fox 13 the type of close contacts investigators want to reach.
Where this patient works, where they live, and who they are friends with. And so what we need to do is we need to find out who these people are, who lives in the household with them, and who the friends are.
You have to rely on someone being honest with you.
Well, if a person works at a meatpacking plant, for instance, and they don't tell us that that's where they work, the employer, his co-workers, they have no way to protect themselves. The disease can basically go unchecked,
which could fuel widespread infection. According to an April 10th study from Johns Hopkins Center for Health Security, it's estimated that each infected person can, on average, infect 2 or 3 others. If one person spreads the virus to 3 others, that first positive case can turn into more than 59,000 cases in 10 rounds of infections. And the work for the contact investigators continue. The health department says investigators have identified more than 4,600 people who may have been exposed to the virus, and about 2,000 of them told to quarantine as a precaution.
And if one of the workers is now positive for corona, they themselves become a separate sort of case.
A scenario that keeps Kimball and his team working the phones at times 7 days a week to trace the when and the who of the person who tested positive.
It feels like a treadmill sometimes.
Do you think you can beat it?
We'll absolutely beat it. Yeah, we'll definitely beat it. Things are happening every day. The contact tracing is having an effect.
So much an effect that the Shelby County Health Department has proposed increasing this team to 130 people on the contact tracer team. Darryl, that Johns Hopkins University public health study that I mentioned in my story, they recommend that the United States have 100,000 contact tracers if the nation wants to be able to get a hold of the coronavirus through contact tracing. Reporting live in the medical district, I'm Greg Coy, Fox 13 News.